The CDC describes the symptoms of attention deficit hyperactivity disorder, or ADHD, as follows. A child with ADHD might daydream frequently, forget or lose things a lot, squirm or fidget, talk too much, make careless mistakes, take unnecessary risks, have a hard time resisting temptation, have trouble taking turns, or have difficulty getting along with others. These symptoms or signs can be seen in most normal children as well, making an accurate diagnosis very difficult and misdiagnosis common. The American Academy of Pediatrics recommends that children diagnosed with ADHD, accurately or not, who are younger than 6, start with behavioral therapy before considering medication. In fact, children of all ages may benefit greatly from even simple behavioral changes. Training and differentiated instruction may be all that's needed to optimize learning for everyone in the classroom without imposing labels. The emphasis should be placed on learning rather than teaching. While an extremely organized lesson plan may be a great way for some students to learn, it may not be for others. A teacher must be able to adapt and alter the plan in order to best address the learning capabilities of each student. Lessons must be presented in a way that the students will learn the material. Unfortunately, there are times when this does not align with the curriculum trend of the day, and many teachers can be penalized for diverting from the prescribed system. All children, ADHD or not, can benefit from environmental, instructional, and behavioral modifications. With insight into the difficulties of learning and strategies for responding to them, ADHD-diagnosed children can be helped through learning and behavioral modifications and avoid referral for medications. There are many different abilities that help make learning optimal. Among them are social skills, memory, language, abstract higher-order thinking, motor skills, sequential thinking, and visual spatial ability and attention. Children may be stronger in some areas while weaker in others. These abilities can be addressed and improved within the classroom and also at home by modifying how information is presented. Again, because both ADHD and non-ADHD children can excel or struggle in each of these fields, it is best to begin with non-invasive behavioral therapies first, reserving medical intervention as a last resort. Here are some strategies that should be implemented in specific instances for children diagnosed or misdiagnosed with ADHD. A child who has difficulty getting along with others or has a hard time taking turns can benefit from the following interventions. Identify and encourage the development of a skill strength or strong interest that the child has. Allow the child to help others using the skill and interest in which they excel. They can help younger students or students who struggle. If the child is old enough, they can also create presentations, lead study groups, or create study tools that help others. This child can also be allowed to help the teacher with materials for lesson plans. At home, the child can be included in decision-making, such as creating weekly menus and shopping lists. They may also benefit from starting or joining a club within their strengths or interests. This can create a comfortable environment with other members that share a common interest. A parent or friend can teach them verbal and nonverbal techniques to interact with others. Role-playing can provide them with a great practice for real social interactions. In cases where children have short attention spans, here are some great interventions. A great start is to discuss any trouble or problems they are having and to help them come up with strategies to implement solutions. Help children to become aware of when they feel bored in class or at home. Encourage them to get up and move around a bit at these times. The motion can help revive their attention and improve their listening skills. Attention and staying alert in order to complete tasks requires more energy than talking to friends. A child's perspective and awareness of this is key to their ability to manage it. When working on an assignment, having the child stop to monitor oneself regularly can be a great strategy. This can be done by summarizing reading after every paragraph or checking calculations after every row. Study groups can be a huge help for these children. Encourage the child to plan before starting tasks rather than planning as they go, and to think before speaking. They should write their essays and reports about events that are familiar to them. Allow the child to dictate some of their stories and have it recorded by a partner or by a computer program. Punctuation and spelling can be corrected at a different time for a different lesson. If the child enjoys art, have them illustrate their stories. Make sure there is a set routine in the morning and at bedtime. Have the child engage in low stimulation activities, such as reading books or magazines or listening to music before they go to bed, rather than watching action movies or playing video games. Break long activities into segments and encourage them to stretch and move around to revive themselves. Also, squeeze balls and other concentrated activities may be great for them to use while they listen. Provide a guide listing specific criteria and have the child assess themselves and the quality of their work according to the standards provided. Have the child monitor and mark their progress towards specific academic or behavioral goals. Some examples could be working for 5 minutes without needing a break, completing all their homework for the week, checking math calculations before turning in each assignment, and other tasks of that nature. Besides math, when dealing with other subjects such as social studies, literature, and history, always discuss the outcome of every action and include book characters, historical events, social issues, and real-life everyday tasks. Have them come up with examples for achieving alternative outcomes. For example, what if during the American Revolutionary War, the British had attacked by sea rather than by land? What alternative outcome could have come to pass, and why? An ADHD-diagnosed child that loses and forgets things a lot may have difficulty with sequential thinking. These children need to be given organizational strategies to use. One strategy may be to make an organizational system for home and school using stickers. If the child is older and able, let them create a system on their own. If they are younger, they can make a system collaboratively with their teachers or parents. Encourage the child to have a study buddy that helps clarify homework and project assignments and can help review for tests. Establish a space that is only for studying and homework. This exclusive dedication for the space encourages alertness, concentration, and good study habits. If the child is older, have them use a daily planner. If the child is younger, they can use an individual visual chart. Using these strategies, we can ensure that all children learn, no matter what the subject is and regardless of individual strengths and weaknesses. That is, if adults are willing to be flexible and patient. There are various programs that can be used to address the many behaviors and skills that affect learning and improve children's general quality of life. 2 of these are called All Kinds of Minds and School Attuned, among others. These systems and others like it can help guide students to form habits that allow them to have meaningful and constructive input in society. But in order for this to be effective, the child must be conscious and clear thinking throughout their childhoods. This means avoiding medications and toxins and remaining as chemically organic as possible. Medicine can only do the bare minimum in some cases, and in other cases may actually be counterproductive. But every child, whether misdiagnosed or accurately diagnosed, can benefit from a little personalized training.